because that's what matters more to Americans than this rhetoric that's put out in DC that they get all the people that are already hyper focused and hyper mad about a lot of things. That's you're hearing the squeak wheel gets the grease. The average American cares about the actual price, actually about what they're going to pay. The actual average American, the middle person, the independent, is tired of hearing about it every day. What are you going to do to fix the cost? I don't care about the subsidies. What are you going to do to fix the cost? So then we have to keep needing subsidies. Fix that, you're going to fix a lot more problems and the government can get out of the way. Let's talk about the potential savings if we went to a little bit more of a model like this, right? Our budget across the board, depending on each state, could be 1.4 billion to 3 billion right off the top. Growth caps, billions could be avoided on top of that every year. Reference pricing, you can save up to $3.3 billion a year alone. Drug reforms, you can save up, and this is on a state average, over $2.2 billion per year. Admin simplification, $1.46 billion a year. And we talked about weight. We talked about prescriptions, things like that, right? We talked, you could be up to 20 to 30, even 40%, depending on the situation. Each 1% saved on healthcare average spending would be $1.46 billion saved per year. You could literally easily shave off $100 billion that we're spending on healthcare almost at a state level, depending on your state, right? Probably less than, the Midwest, right? Because of our cost structure. What could your state do with billions extra every year? Should that money go to bureaucracy or should it go to schools, bridges, families, taking care of problems that we need to take care of without raising your taxes? Think about billions going back into schools, bridges, infrastructure, all those things you need that we need to get fixed in our states without having to add extra taxes. Makes a whole lot of sense, right? Because we need problems to be fixed because a lot of our infrastructure is crumbling. Things look like crap. Who benefits when the crops run wild? It sure isn't the average American, only the system. If you're insured and still scared of the bill, you're not alone. 4 in 10 feel the same. Like I've said, subsidies don't cure the disease. They're just hiding until premiums jump and they raise your taxes on top of it. States can lead. Maryland proved it. California capped it. Like I said, there's a lot of gray area in there. But they took action. They had the courage to do it. Does your state have the guts to do something for you? Ask your state senator, ask your state representative, do they have the guts to do something that helps you, the average taxpayer? And ask it to them just like that. Do they have the guts to actually do something for you? Competition needs a referee, but there's also got to actually be competition and not a rigged system. And we need a scoreboard. So here's the bottom line. Subsidies are a trick and a lie to get both sides to fight against each other because the healthcare companies and drug companies line their pockets while you're busy fighting.